Hi, I'm Susie. I'm the nurse practitioner at Transformations. We're here with Rachel today. We're going to do some filler. So Rachel's in for some cheek filler. What she notices the most is kind of a little deficiency through here. We were talking earlier and she actually sleeps on this side. And you know, everybody's face is asymmetrical, even though we think it should be symmetrical. Really, it looks kind of awkward when you put your two same sides together. So it's actually the asymmetry in our face that makes us look the way that we do, and it actually makes us look more beautiful. And you know, clearly she's very beautiful. So, yep, especially when she makes that face.
I tried to move my eyebrows, but I couldn't.
Okay. So right here is kind of what we're talking about filling in so that we can get things a little more even with this side. So doing something like this, I don't know if you can tell from the camera, but kind of fills that in to make it look a little more even through here. And then we'll actually kind of just blend it out this way, kind of like a little Nike swoosh. But, you know, blending it out this way will give her a little bit more contour through here too, which is kind of what people like to create with makeup, but she'll kind of have it naturally. Usually when I look at a patient from a 3/4 view, I want this to be the highest point of the cheek. So we're going to keep that as the highest point and just kind of blend things through here. When we add the volume through here, we're actually going to get a little bit of lift too. And this was something that kind of bothers her as well. And she doesn't really have any, you know, other issues kind of down here. But what most people do when they lose this volume through here is they start to get nasolabial folds, they get these marionette lines, and eventually they get a little heavy jowl. So that's not what's going on with her. She just kind of wants to correct this, but adding the volume through here will help give us that lift there. And for patients that have those issues where they have the nasolabial folds, they have the marionettes, and they have these little jowls, adding the volume back into the cheek where it used to be is going to actually lift all that. So we're going to use some product today called Restylane Lyft, and we're going to use a cannula. So when we do injections, we typically either use a needle or we use a cannula. The difference is a needle is obviously sharp. The benefit with that is it's a tiny needle, it's sharp, and it can be very precise as where we place it. The downfalls with using a needle is more risk of bruising. The opposite of that would be the cannula. The cannula is a blunt tipped, essentially needle or tube. What I would do, I'm going to do a little poke kind of right about here or right here in the hairline where you can't even really see it. And then I'll be able to access the area that I want to inject through that little one poke. And I'll just thread the cannula through and then lay the product down. So doing that will actually limit her risk of bruising and actually be probably a little bit more comfortable for her as well. All right. So we're just kind of preparing the face. I'm going to have you rest your head back for me though. Okay, so we're done injecting. You know, we've added some product through the arch here to contour the cheek. We filled this little area in where she had that deficiency. And then just even some things out on the other side by adding a little contour and then keeping that as the high point. So looks pretty even, looks pretty great, I think. And so afterwards now, she's done, there's lidocaine in the product, so she feels a little bit numb through here, and that usually lasts a couple hours after injections. So don't be surprised if you feel some numbness. She can go back to work, she can go do whatever, she can put makeup on, there's no restrictions from any activity. But we used a hyaluronic acid-based filler. Those products typically last you about a year. It'll be a gradual decrease in product over time, but usually around a year, and then she'll be due back for more.